The situation in Europe is serious. In 2010 alone, we lost 100,000 people due to AIDS in Europe and Central Asia. And in 2011 and 2012, the situation was even worse. 100,000 people means 10 times Brussels University student base, and this means more than the whole population of Avignon.
In the low and middle income countries of the European region, only 30% of people in need of HIV therapy are accessing HIV therapy.
We have seen today that the HIV and AIDS situation in Europe and the neighboring countries is far from being under control. We don't want to be left without a communication and a commitment from the European Commission beyond 2013, and so we really push for a new political commitment from the Commission, and we would like to get it now.
We are here in Brussels today for a very important cause to keep HIV and AIDS on the agenda. We're all European citizens, and that's why we're here in Brussels to urge the EU leaders to keep this on the agenda and to have money for it, because that's what we need.
What is happening in my country if people who live with HIV build themselves clinics for treatment of HIV? We ask you to develop a new strategy and action plan on HIV for Europe.
We have a huge problem in my country when the hundreds of thousands of people have HIV status. And we need a political will on the highest level to stop the epidemics of HIV/AIDS. And we need 100% access to treatment in my country.
You, the elected MPs, are the representatives of the people of the European Union. European Parliament is the house of democracy in European Union. We know that you are committed with the respect and full implementation of human rights. We face a crisis on HIV/AIDS, and we need you to back that EU will not retreat their support to HIV/AIDS.
Europe and European institutions cannot lag behind the efforts that are needed to increase treatment, to reduce new infections, and to get to zero the number of deaths by AIDS.
We need strong message to national leaders from European Union to act effectively and implement evidence-based interventions. The main challenges for effective HIV response in Lithuania are political leadership and financial resources.
Europe faces one of the most important crises in its history when it comes to the HIV epidemic. We have to really enforce a new policy that looks into early detection of our people living with HIV. If we do not do that, if we are not successful at doing that, everything we have achieved well in the past at a national level and at a European level will be to waste. Please look at the data, see how we can really end the epidemic. We have to have drugs that are accessible to all the people that need it, and we need to detect the people earlier and earlier so we can cut the chain of an HIV infection in our region.
I want to urge very much the European parliamentarians to always consider the needs of the most vulnerable and most at-risk populations in terms of HIV. Please also remember about the people who are marginalized, undereducated, poor, and socially excluded, and they are an integral part of our society.
We ask that this point need to be taken into consideration for the future. The criminalization of sexual work and the right of migrant sex work and other sexual work to have access to the health.
We need to redouble our efforts to reduce the number of undiagnosed. And in order to do this, we have to take away all obstacles that make this difficult for people living with HIV, and that is the discrimination in the workplace, the problems that people face in the healthcare, and of course to ensure access to treatment for all people.
We need to scale up much quicker, and we need to particularly focus on the especially vulnerable populations. These are drug injectors, men who have sex with men, migrants, and prisoners.
Dear colleagues, members of the European Parliament, The reality is that AIDS and HIV hasn't left us. We're dealing with the epidemic. Yes, we recognise that it's happening in other parts of the world, but the reality is it's here in Europe. The epicentre of this epidemic has shifted away from Africa. It's in our near neighbourhood. It's in Russia. It's in Ukraine. It's in our city centres, the capitals of the European Union. That's why I want you to commit to make sure the resources are given to the European Commission, are given to the Global Fund, to the NGOs, to ensure that we can prevent people either contracting the HIV virus or having to live with the HIV virus and the discrimination and the stigmatization that goes with it. Finally, if you can't imagine what the HIV virus is like, imagine your daughter, your son, your granddaughter, that they suddenly are infected with the HIV virus and they don't have access to Medicare, health treatment, and the medical care that will make their lives better. And imagine the discrimination that they will face solely because they're HIV positive. If you wouldn't want that for your granddaughter, your daughter, your son, why should we allow it to happen to another? Connect and change the lives of others. Thank you.
We all need to work together. The European Commission, members of the European Parliament, members of parliament in the countries, the civil society, and we all need to do it to save thousands of lives. And we all do our work because we care about the lives and well-being of citizens of Europe. We need actions that are bold and effective, and we need them now.